Specialised investigation teams handling family violence cases and more training for officers investigating sexual crimes. Now, these are some of the initiatives announced at this year's Police Workplan Seminar to better manage sexual crime and family violence cases, as well as victim care. A family violence team will be formed in each of the police land divisions. They'll be part of the new Sexual Crime and Family Violence Command to be set up by next year. Community policing officers specially trained in family violence will also be appointed from June. Now, they will escalate potential high-risk cases to social service agencies for early intervention. Officers who investigate sexual crimes will be given additional resources and training to learn how to better manage victims throughout the investigation process.
Police officers have to be trained to identify vulnerable victims. Police officers will undergo family violence sensitivity training to recognize signs of family violence and better support abuse victims. Police officers are also trained to handle sexual crime victims sensitively and with dignity and respect to reduce the likelihood of re-traumatization.
The police has also been working with the Institute of Mental Health to provide better support to those with suicidal tendencies. Officers can now call a dedicated crisis response team hotline. It's manned by IMH nurses and counsellors who can either speak to the person over the phone or go down to the scene. This will help police determine a management plan on how to better help these individuals. Police have made over 2,000 calls to the hotline since it was introduced, 14 of which were on-site activations.
Our experiences in the past also showed that there's been IMH coming to the hospital is still seeing a psychiatrist is still associated with a certain level of stigma. So many family members and many patients themselves are very reluctant to do so. So having this on-site assessment actually helps a lot and allows us to have an assessment on the ground to see what is the most appropriate action to take next.